Hi, I'm Marie Plant, and I'm conducting an interview on Miss BJ O'Connor, and she is a nurse manager at the Palmetto Surgery Center. And here's Miss BJ right over here. All right, Miss BJ, in one word or phrase to describe nursing, what would that be?
Okay. I've been in nursing for 32 years, and I would say the phrase that comes to me is variety, diversity, and flexibility. Once you're a nurse, it opens you up to several aspects. You can go from caring from neonatal, the very small, to the geriatric. You can deal with a variety of cultures, and it really makes you have a holistic respect for the individual as a person, not just the medical aspect. You're looking at the whole situation from emotional, social, physical as well.
Okay, and so how would you say all that goes into the image of nurses and how you would see them, and with all that, like what would be your ideal image of a nurse?
I think the image of nursing has changed in the sense that when I first became a nurse, we were all medically, physically looking at the patient. But now, with the economy, the financial aspects, the stresses on families, you have to look at the whole perspective, not just the patient as an individual, but look at that family system. How is this patient going to be cared for? Who are the caregivers? Do they have people at home to help them? Medication-wise, their appointments, do they have transportation? So you have to look at the broad spectrum of the services rendered.
Okay, and what would you say some of the negative images of nursing that, when they don't help out with all of that or think about that?
Well, I think the phrase that comes to mind is, as we talked earlier, nurse ratchet, the mean nurse that is just there to do the shift work, that's ungiving, that's uncompassionate, and that will not take that time to listen to what the needs are of the patient, because it may not just be physical needs, it may be emotional needs, it may be support. So that's why you have to look at the whole individual, not just at the medical aspect of nursing.
Okay. And how would you say the media, such as some of those television shows that are well known, like ER, Grey's Anatomy, or House, affect that image and how people think of nurses?
I've watched some of those. I think some of those are not a true perspective of nursing. It's kind of like when you get out of nursing school, you read the textbook, they tell you how things are to be done, but until you get into the field and you're working hands-on, you really see how things are. Some of those shows, I think, speak a lot to relationships, some inappropriate relationships that seems to take over versus the real need of what we're here to do, taking care of the patient and advocating for that patient.
Okay, so you would say that whenever when we're in nursing school, and some people that are trying to get into nursing, when they learn that textbook, it's very different from when you're actually in the field and you're learning.
I think textbook gives you the background, but hands-on is where, until you're in that situation, you can read about it, but each situation is different. So you're going to have to be more accommodating. You're going to have to be able to use those basic principles that you were taught, but it's going to depend on the situation and what's going on, how those are applied.
Okay. All right, and so we've already said the image of nursing has changed over time, and you said that it used to be kind of focused on the physical, just, what does the patient need physically, and, make sure they're not sick. But also, you said it's started to change to be more emotional and, I guess, maternal. So
I guess it's, you have to look at the whole perspective of nursing, not just the physical needs of the patient. You've got that individual who has emotional needs. You've got that individual that's got social needs. So you have to look, and not only just at that patient, but at that family system altogether. Because who's taking care of this patient? Who's helping this individual with their care? Okay. So it's outside of the immediate, hey, this is a diabetic, we're going to give them a shot. Well, okay, who's going to help them monitor their blood sugar? Who's going to help them get their medication? Who's going to help them give their shots? Those type things.
Okay, so you would say,
I would say it's a holistic view approach with not just one individual. It's a system, a family system. Family could either be a friend, it could be a church member, whomever.
So it would be like, also we're learning about, like, that's kind of goes along with thinking critically as a nurse and not just following those, those 1, 2, 3 step rules that, a lot of people like us think that nursing might be an easy job since there are so many people out there that go into nursing, but actually you have so many other things you have to think about.
Nursing, you have to think outside of the box, and not every situation is going to be the same. It's not going to be, okay, this is what's going on, this is how you treat it, because you're going to have different things thrown in there, and you're going to have to look outside the box.
Okay, so you would say, I guess nursing is a little different from, I guess, being a, MD, they kind of focus more, I guess, on, like, the numbers and, the actual treatment, but you have to focus on the patient's, like, emotional needs because you're kind of by their side a little bit more.
It's a multifaceted profession in the sense of how you treat a patient. That's where diversity, flexibility, and variety come in.
Okay. Thank you so much for your time. Appreciate it.
Thank you.